So the first thing I did was get my degree and my good standing certificate issued again. So they verified my degree, and I had to arrange for another good standing certificate for the Pharmacy Council of New Zealand for the initial consideration. And then I got in touch with them. I said I've already given the OPRA exam and it still holds valid. So they were kind enough to consider, and they directly verified my examination results, and it was all sorted till there. And New Zealand Pharmacy Council was quite helpful with everything, and they didn't ask me to arrange a lot of documents for that, or like didn't disturb me much. So those were the initial consideration and the steps involved in just starting to getting there.
Initial documentation. Like the most important thing is that we have to clear the English exam, and for New Zealand,
yes,
New Zealand it is IELTS or OET. So these are the only two options.
Yes.
Unfortunately, there is no PT for New Zealand and no TOEFL, IBT, or the Cambridge and Michigan English test and self-pip. Okay, so Australia will accept a lot of other English language tests, but New Zealand only two exams, either clear IELTS or either clear the OET. So
yes, sir.
Yeah.
So then, I had to give IELTS again. So I had given PT for Australia, but then for New Zealand it was not acceptable, so I had to go for IELTS again. Yeah, but in first attempt I was lucky enough to get enough scores.
Hello guys, welcome back to another video on Elite Expertise, and today's episode, this video is quite completely different, okay? Because most of the candidates, those who have cleared the KAPS examination or OPRA examination, so they will be having an interest to move to Australia to become a pharmacist or to New Zealand to become a pharmacist. So in today's video that we are going to discuss mainly about how to become a pharmacist in New Zealand even after you clear the KAPS examination or the OPRA examination for Australia. Okay? Is it possible after clearing the KAPS examination from Australia and move to New Zealand? And can we become a pharmacist up over there? And how many steps that are involved? What are the things that we have to do in order to become a pharmacist in New Zealand, even after you clear the KAPS or the OPRA for Australian pathway? Okay, so we have a special guest with us today. So everyone know Divya. So she's one of the famous person for Elite Expertise. So she was with our team before, and now she's in New Zealand and she's pursuing her internship over there. And she's working as an intern pharmacist. So let's get few more points, like let's get complete details about how to become an intern pharmacist in New Zealand and how to start the internship in New Zealand, because Divyanshi also cleared the KAPS examination for Australia pathway. So she did the KAPS for Australia, but later she decided to move to New Zealand, and now currently she's in New Zealand and pursuing her intern pharmacist up over there. So she's doing her internship up over there. Okay. So hi Divyanshi. So how are you?
Okay.
And how many hours that you have to work and
So it's like a usual 9 to 5, but there's quite a lot of things to learn at the pharmacy. So we start off with dispensing prescriptions, and now that the flu season is coming, I had to do additional course of the vaccinator training. And yes, I have also done a B12 injection training. So we at times administer B12 injections as well when patients come in. And so there are sometimes people coming with minor ailments that we have to address, or if we are to send them to a GP. So yes, so those are kind of like a brief overview of how it goes and the tasks that are involved throughout the day. Yeah.
And like it starts from 9 o'clock to till 5 p.m., right?
Yes.
9 to 5.
Yes.
Okay. So then like after 5, I guess you need to keep doing some other things like preparing for your assignments for ITP and preparing for your examinations, the upcoming examinations, the OSCE and so on.
Yes, sir. So recently I had a dispensing assignment where we have to dispense 50 drugs and then make 50 labels and 30 items. So there are dispensing assignments that we have to submit, and then there'll be a calculations assessment which we can do in 3 attempts throughout the year.
Yeah.
And there is also a public health promotion assignment. So they keep having assignments and they give a timetable every year, which we can just print out and keep it in the dispensary so that we have a track of
all
it.
these assignments like according to that schedule that have been provided. Okay?
Yes.
And to make sure that before we finish our internship, we have to finish all the assignments and complete the
Yes.
course.
Yes, sir. And I'm missing on one more thing. There's a monthly portfolio as well that has to be submitted. Yes. So we have to simultaneously work on whatever we are doing, common, like most significant interventions or most significant public health interactions that we've done, or the extemporaneous preparations that we are doing. So we have to log those as well.
Those things, and the preceptor has to keep
signing them off. Yes.
Those things. Okay. Yeah, so it's like pretty much quite similar to how it works in Australia, the ITP course. Okay. But the only difference is when it comes to the examinations. In New Zealand, it is the OSCE pattern. That is the 10 stations OSCE. But in Australia, there will be a written examination and a separate oral examination. So these are the only differences at the end. But everything, it remains quite similar to Australia and New Zealand. And the interesting thing, like as Divyanshi, as you are in New Zealand, like after becoming a fully registered pharmacist in New Zealand, you can also move to Australia without any sort of examination.
Yes. Yeah. Yes, so that is going to be quite easy to just transfer my license from New Zealand to Australia. Yes.
Yeah. So that pathway is the Trans-Tasman route, through which easily we can convert the New Zealand license to Australia license, or someone from Australia, if they want to go to New Zealand, then they can convert the Australia license to New Zealand license without any sort of further exams or without any sort of further assessments and so on. So that's quite interesting between these two countries, like the New Zealand and Australia. And Divyanshi, like as you are working as an intern up over there, like what is the main challenges that you face? Is there any challenges that like especially when the overseas pharmacists, they come to New Zealand the first time, so how they have to get prepared themselves?
So I think, sir, I had an advantage of a strong background in understanding the language and speaking the language. That could be a very big barrier. So I think English is like a very important thing, having a strong communication skill. When it comes to challenges, I'm not sure. I haven't really had like really challenging situations, but I think the timelines and the submissions when it comes to the PSNZ intern training program, and we just have to keep studying, and there's always something to learn.
Exactly.
And it's like quite fast-paced.
New things will be coming up, and every day that we need to keep learning new things, and those are quite common. That
yes, sir, there's a lot to learn. And one more thing that I found challenging when I just entered the dispensary was the software, and how to operate those.
From overseas, when we come here, even by the time in 2018, I moved to Australia and I started my internship in Australia. So even I had a lot of difficulties, like the few things that I have faced up here. The main thing is that we are completely new to the system. Okay, so the only thing is that at first we had to learn the system, like how it works. Okay, so we are completely new to the system. So that's where we will be a bit lagging at the beginning. But it's a matter of only a couple of weeks. So within a couple of weeks, we can come into the track, okay? And we can keep going from there. But the first few weeks, like we will keep facing some, like we have to struggle and we have to know that, especially when it comes to the medication, the brand names will be different here, like what we have
Yes, absolutely.
in our home country. Okay, so the brand names will be different, and some procedures and the policies that what they follow here. Okay, so those things will be completely different. So especially when patient they come to the pharmacy and they say that, hi pharmacist, I have this headache. Hi pharmacist, I have this nausea sensation. Hi, I have this rash on the skin. Okay? So like for overseas candidates, it becomes much big challenge initially when to diagnose and to recommend an appropriate therapy for them. But in case if we learn all those things, then it becomes quite simple and quite easy.
Yes, sir.
Countries.
Yes, and the same thing I would like to add that I've had patients come to me and tell me, I've been using so and so medication, and I'll be like, what are you using? And we just don't know what are the OTC products, and they'll be like, I'm using so and so thing. I'm like, what? And then I have to just run to my preceptor saying, this person is saying they're using this. So that's also something that's a little challenging.
Yeah, exactly, it is. Okay. So these are the things that we face, especially at the beginning. But once we get used to it, and after clearing the exams, because at OSCE level, we'll be preparing in detail about all this primary healthcare issues, that is the over-the-counter and pharmacist-only medications, okay? And all these things that we'll be preparing in detail. So with that, everything will be quite clear for us, and it becomes quite simple when once we become a fully registered pharmacist after cracking this exam. And final question, Divyanshi, like in Australia, for intern pharmacists, the current pay rate is like they can get $29 to $30. That is the standard all over the Australia. Wherever they work, they can get up to $30 per hour. I'm just wondering, like, how much will be the pay rate that the intern pharmacists they can get in New Zealand per hour?
So here, I think, sir, it is between $26 to $28 an hour.
Okay.
Yes. It depends on what areas you worked on and like what kind of background you come from. For example, I had the clinical experience back in India, so that kind of helps. So they just consider the background as well for that.
Okay.
Yes.
Sure. Yeah, that's quite interesting. And Divyanshi, are you staying in the cities or in a regional area?
Grabbing an opportunity in the cities is quite difficult. I got one in like a little outer region of a proper city. So it's just outside the city.
Outside the city.
Yes.
Even the same thing that with me also. Okay, first time when I moved to Australia in 2018, I tried almost all the pharmacies in Melbourne, all the pharmacies I sent the resumes to all the pharmacies, okay, in Sydney, Melbourne, and in person I went to all the pharmacies in Adelaide. Mm-hmm. But there was no opportunities, especially in the metropolitan areas. So because the students, those who have studied here in Australia, they will grab the positions in metro.
Yes.
They are not ready to move to some regional areas and work as an intern there. Then I realized that, okay, so this is not the correct way that I'm looking for. So I have to move to regional areas, and then I have to start looking for the internship positions. Then when I start looking for the regional areas, internship positions in the regional areas, then I got the opportunity up over there. So, and the place where I did my internship, it is almost like 400 kilometers away from Melbourne.
Oh.
And, yeah. So,
that's a lot.
Yeah, it's a lot. Like we have to travel, and even right now, those who are doing the internship in Australia, so most of them, all our students, elite expertise students, so they are traveling, like they are only for the purpose of internship, they move to regional areas. They have the permanent residency, they have the citizenship, means they can stay in cities, they can stay in metros.
Yes.
Just to pursue, just to complete this internship, they are for 1 year, they are sacrificing their life. So they are moving to the remote areas and they are staying there for 1 year.
Yes, sir. But when it comes to regional areas, sir, what I've observed is people are quite friendly, and
So that's
they are quite warm and very welcoming of outsiders as well. So I've had people tell me, "Don't leave the country." So they're just very keen on having people. Yes.
Yeah, and also in Australia, especially in regional areas, they will provide other benefits like accommodation. They will give the accommodation in regional areas, whereas in metros, no accommodation. So just for accommodation, it will cost around $2,000 per month.
Yes, sir.
So
yes, sir.
If you stay in metros like in Sydney, Melbourne, Brisbane, and all these places, so they can't get any accommodation. But if we move to the regional areas, then at least we can get some sharing accommodation initially. So where we can save almost like $2,000 per month, which is a huge amount. So, well, it's nice talking to you, Divyanshi, and having a lot of information like how to get your pharmacist up over there in New Zealand. Okay? And once again, we will have the interview with you. And once you finish your OSCE examination and once you become a fully registered pharmacist in New Zealand, then
yes, sir. Fingers crossed.
yeah, soon it's going to happen. Okay, so definitely we are going to have a complete interview with you, like how you have prepared for the OSCE examination and so on. And in case, okay, by any chance, if we come to New Zealand, then we will visit up over there and we can have
sure, sir.
Face-to-face interview. Or if you come to Melbourne,
yes, that could also happen.
yeah, it can happen. Okay. Anyhow, thank you so much. Okay, thank you so much, sir.